Oftentimes, we're discussing with patients, options to replace a missing tooth or replace several missing teeth. And what people need to understand is there's really only 4 options. You either leave the tooth out and live with it, which sometimes people tend to do, but if we're talking about replacing the tooth, there's non-removable options and there are removable options. Removable options to replace a missing tooth, we're typically talking about a removable partial denture of some sort. It comes in and out of the mouth. Oftentimes, that's a choice that people go to simply from an economic standpoint. It can be less costly. But the cons, you have a big piece of hardware, it tends to be uncomfortable, and a lot of people don't like having that extra, hardware in their mouth. The non-removable options get into either a traditional bridge or an implant with a crown on it. And there's pros and cons to both. A traditional bridge is where you're missing a tooth and we actually crown the teeth on either side of the missing tooth and attach an artificial tooth to the middle. So it gets cemented on as one piece, and that's what was the traditional non-removable option before dental implants. The cons to a bridge is you actually have 2 teeth attached. If you get a cavity on one tooth, the whole thing typically has to be replaced. With the option of a dental implant, we essentially replace the missing tooth with an implant that sticks up out of the gum and essentially allows us to put a crown on it as a separate restoration. So then you don't have to grind down the teeth on either side of it, and you don't have to connect them together. So if there's ever a problem with any one of those teeth, the teeth get treated individually.